Hi, I'm Dr. Cheryl Toussaint. I'm the Director of Therapy Services at Carthage Area Hospital.
And I'm Dr. Valerie Gamble. I'm the lead physical therapist at Philadelphia Physical Therapy.
Today we're going to demonstrate some exercises. We are going to start with hourly self-stretching exercises from Tri-County Orthopedics.
This is a good warm-up exercise. Holding onto a table or back of a chair with your good arm, bend forward a little and let your surgical arm hang straight down. Using the momentum from your hips and legs, guide the slightly swinging arm back and forth like a pendulum, then in circles that start small and gradually grow larger each day as the pain allows. As you have less pain, try bending over a little farther to do this exercise. This will increase the amount of movement in your shoulder. Be careful when doing this exercise not to bend over or stand up too quickly so that you become dizzy. You should have breakfast prior to doing this in the morning. Start by placing your arm at your side and elbow bent at 90 degrees. Stabilize the arm by placing your forearm against the door frame. The shoulder needs to be in line with the door frame. It is very important that your elbow remains touching the side of your body and stays bent at 90 degrees. Turn your body out away from the door so that your surgical arm rotates out to the side, pivoting your feet to 90 degrees. Keep your elbow tucked in against your side and do not allow your elbow to extend during this exercise. If you have trouble, use your other arm to pull the elbow back to the side. Hold this stretch for 10 seconds, then return to your starting position before you let your arm down. With your opposite hand, hold your affected arm palm outward behind your back by the wrist. Pull your arm up gently to stretch your shoulder. If you are unable to get your arm up high enough to complete the exercise, try pulling a towel over your opposite shoulder. Put the hand of your surgical arm behind your back and hold the bottom of the towel. Pull gently on the top of the towel to gently bring your arm further up your back to stretch your shoulder. Hold this stretch for 10 seconds and then slowly return your surgical arm to the starting position. Do not let go of the towel until your arm reaches the starting position. Do this exercise at least once an hour while awake, but the more repetitions you do, the better your range of motion will be and the faster you will get it back. Here is an alternate way to perform the internal rotation exercise. Facing a wall, stand so your fingers just touch it, hands close together. Keeping your shoulders down, don't shrug up towards your ear. Walk, do not slide the fingers of both arms up the wall as high as pain permits. This will improve the more you stretch. As your pain and range of motion improves, step closer to the wall so that you can walk your fingers further up the wall. Try to reach higher each time. Once you have regained your full range of motion facing the wall, keep the surgical arm up on the wall and turn your body 90 degrees so that your side is against the wall. When you make this turn, your arm may come forward. Keep your stance wide with your rear foot placed against the wall. In between your elbow and armpit, use your other arm to push your surgical arm back so that it is straight up in a line with your body, and then lean into the wall. Hold that position for at least 10 seconds, then return to facing the wall. Slowly walk your fingers back down the wall to the starting position. No sudden movements. Start by lying flat on your back. It is very important that you keep your back flat against the bed or floor when you do this. Do not arch your back. Raise your surgical arm up over your head. When you start to feel stiffness, use your other hand to gently push the surgical arm down over your head. Place your other hand in between the elbow and armpit of the surgical arm. It will help if you take a deep breath, and as you exhale, you slowly push the surgical arm down over your head until you are able to get it to touch the bed or the floor.
Thanks for watching. We look forward to seeing you in our clinics.